We will talk about home remedies for toothache when we have no medications around, and first and simplest way is salt water rinse. It's effective especially for mild and moderate toothache, and half a teaspoon of salt we can dilute into 1 glass of water and rinse into mouth around 30 seconds, and it's usually enough, swishing around the mouth for 30 seconds, and it causes pain relief. It also inhibits plaque formation, so not only as an anesthetic but also antibacterial action of salt water is important, because salt creates unfavorable environment for bacteria, so salt water causes less bacteria in affected areas, and it kills also bacteria. And there's also studies that gargled salt water decreases risk of common cold and other respiratory viruses and respiratory disease risk by 36%. So it's effective for prevent common cold also. And how it does everything this, it cleans mucus, and it has anti-inflammatory effect and osmotic effect. It means it reduces mucus swallowing. Also it causes clearing of mucus from bacteria, from debris of dead cells. That's why it cleans our mucus, and it creates unfavorable and hostile environment for bacterial growth. So salt water has analgesic effect and also has antimicrobial effect. Second, an effective way to reduce toothache is clove oil. Clove oil is common and is highly effective topical anesthetic, and we even have studies where you can compare benzocaine and clove oil and placebo, and both benzocaine and clove oil were superior to placebo, and both were same effective. It can irritate your mucous membranes, that's why you should be safe with clove oil, but it's highly effective. It also has anti-inflammatory effect, antimicrobial effect, and to reduce this irritation you should dilute clove oil into carrier oil. Carrier oil can be any oil, any edible oil you can at home. It can be sunflower oil or coconut oil or almond oil. You should dilute clove oil with this carrier oil, and you should apply topically with swab, cotton swab usually, and you should avoid swallowing also, because it can irritate mucous membranes. So it has antiseptic effect also, and it's widely used as a component of mouthwash also. And garlic is well-known food, which is well known for centuries and used in medicine also for centuries. And you can add raw garlic on painful area for several minutes, and it decreases pain. Importantly, it's effective. Also, garlic has potent antimicrobial activity. It contains allicin, which is strong antimicrobial component, and it's also antifungal. It's important because it has antibacterial action and antifungal action both, and both this action is really important. Also, garlic is used for periodontal disease. You can crush garlic and apply on inflamed gums, and you can place them for several minutes there, and then you can mouthwash with anything, with water for example. Also for oral ulcers it's important. You can apply sliced garlic clove and it reduces inflammation, reduces bacterial growth. And it's important to note that garlic is not only topical antimicrobial, it has systemic antimicrobial effect. It means if you eat garlic, it has antimicrobial effect in whole your body. It's very important actually. It decreases bacterial number in whole body, although its action is weaker compared to direct and topical action. Systemic action is of course weaker, but it still has systemic action, and it's important because there is no always antibiotics available, and we don't know what will be also in future. So we should know that garlic is strong antimicrobial food, and we should always have garlic in our kitchen, because we don't know when we will need it. That's all I wanted to say. Thank you for your interest, thank you for your watching. If you like my videos, please thumbs up. If you like my channel, please subscribe. Thank you very much. Bye for now.